Standing by in the KUAF News Zoom room. Doc, I don't know if you thought all these letters, these Dear Governor letters you were writing to Adelup, I don't know if you thought maybe you might have had the wrong address because it looks like they were going in the same mailbox that Jim Moylan's letters go in. But they finally wrote back to you. It looks like they had a slow day at Adelup. They were like, let's respond to Gura. Hey, while we're at it, go write Dr. Shieh a letter. Why not? Hell, guys.
Oh, Chris, thanks for the laugh.
Yeah, you know.
But when I write those letters to the governor, it's not, I don't expect a response because in the letter it's just asking for a consideration. I know she's busy, so and today's my grandson's birthday, so I have to be really nice. So
Okay,
happy birthday, Maui.
We'll call you tomorrow then. We'll call you tomorrow if you're going to be nice today. We'll just talk to you.
No, I'm excused for the next 15, 20 minutes.
Because it's halftime.
Right.
The Packers won today too, so it's like, wow, we beat the Lions. I mean, what can you say? 2-0. And in the middle of the pandemic, we have football season. I mean, how good is that, right?
I know Adelup is like, don't worry, Packers are playing. Dr. Shieh ain't gonna say anything. We got a couple of days of downtime. Yet here you are, Doc.
Right.
So just if you could unpack the governor's, I guess start with your letter and then unpack the governor's response to you, and then maybe walk us to where we're at right now.
Well, my letter just basically asking her to not lock people up, as they arrive at the airport. Those are people of Guam. Those are residents of Guam, and many of them came in with a pretest already negative, which is above and beyond what the Center for Disease Control has asked for as far as arriving passengers. So my letter to her is basically based on the CDC guideline, and I just don't understand where the science is. When you come in, you lock them up in a hotel for 14 days. If you're going to use the same concept, then you should be locking up all the positive that's in the community of Guam. Even herself and the lieutenant governor, that's positive. Even Will Castro was positive. Dr. that was positive. Why don't you lock them up in the hotels? They're at home, and there's a lot of negatives that's at the hotels. Thousands of them that are negative, and they're locked up in the hotel. So those to me are innocent people, and they should be home. The emotional and the mental toll on them is quite a bit. They come home to be with family. They have homes here. What gives us the right to lock them up, especially when you don't have proof that they're guilty of a crime? And during the pandemic, we see our justice system letting go burglars back home. They post a bill and they go home, or they, because of COVID in the jail, the risk is high. They get to go to their homes. I don't see them locked up. So I think the issue with the governor's way, or she's saying it's her physician's medical advisory that's telling her that. And then the medical advisory team is saying, no, she's doing that. They're pointing fingers at each other. I don't know who's right, who's wrong, but I think they're all wrong. I think what we should do is open up Guam, let the people go home. Is that a spam mask? No, that's a Guam spam.
Yeah, it says Guam. Yeah.
Okay. Just caught me by surprise there. But
just keep going for Dr. Shieh.
Wear your spam mask and watch your distance. Carry alcohol. There's tons of this sanitizer around Guam now. There's no shortage of it. There's no shortage of masks. Watch your distance, and we need to open up Guam. And I think if you look at the recovery rate, let's say for example, we tested 20. I think we've gone over 20,000, right? 20,000. And we tested 2,000 that were positive. Out of the 2,000 that were positive, we had about 30, let's just say we have 40 deaths, okay? Or 50 deaths. We're looking at probably a 97%, 98% of people who tested positive that actually have recovered. And those people who had real bad comorbidities, heart disease, hypertension, diabetes, cancer, those are the critical comorbidities that we really got to focus on. Lee Weber wrote a letter today, and I agree with him. He's saying that, if you really think about it, if public health is doing this for the safety of our health, you see alcohol on the shelf, you see sugar on the shelf. What else do you see on the shelf that's real harmful? A lot of things that's on sale that are real harmful, and public health is not doing anything about it. So those are the things that I think Adelup and public health has to be on the same page. Now, she issued a recent order that took back some of her orders, but it doesn't make sense. From what I'm hearing from Adelup, and I've been reading what she wrote again, and I think what she's basically saying is that you're still going to be locked up in a hotel when you arrive, regardless.
Yeah.
But basically, she kind of took herself out of the picture. Or if I'm reading right, that she's basically saying that if you want to get out, you got to go to the judge.
Let me just read, Doc.
Go ahead.
I just want to read the statement that we had sent out to Rachel Azuzu, who's kind of right at the front there with Attorney Terlai and Attorney Fisher and representing clients. She had asked us if we were going to get anyone from public health to talk about the new EO. And, well, we have asked them to come on and talk about the quarantine specifically, but it's tough because if we're going to get public health and it's either they're going to come on and talk about the quarantine or they're going to come on and talk about the COVID response, then obviously we're going to choose the COVID response. But this is what Rachel's interpretation of the new EO. She writes, Chris, what the new EO does is invalidate the mandatory quarantine at a government facility. It still allows for quarantine of 14 days, which may be at a government facility, but it does away with subsection A of the DPHSS guidance memo 2020-11 Rev 7, which says all passengers must be quarantined at a government facility. The memo was referring to a section where the new EO rescinded. The new EO is unclear considering the government's tactics in keeping these people in the dark. I doubt the focus is on what the travelers want. I think this is yet another tactic in trying to get the court to decide that these people truly volunteered to be in a facility. The court already decided that people did not voluntarily go into custody because the EOs made quarantine in a facility mandatory. We have a hearing this week on government's motion asking the court to reverse herself on that finding. There you go. So that's
what? So it rescinds but not rescinds?
It's like a raise, not raise. You know what I mean? It's one of those things.
Yeah. Now, I have patients who are locked up in hotels. And I'm trying to get them out, and I will get them out. But here's the thing. They have no reason to being there, period. What the government has done is that basically they give a piece of paper and they say, hey, this is a voluntary quarantine. You got to sign it. And then they'll say, hey, if you don't sign it, you have to pay a fine or you could be thrown in jail. Basically, that's what all of my patients, all the friends that I know that's been in the lockups at the hotel. So if they're not really giving them a choice, and even if they give them a choice, let's say a patient comes in and they say, okay, I don't want to be locked up. I don't want to sign this paper. And say, okay, well, fine, get in the bus. We're going to take you to the hotel. We'll lock you up anyway. What choice is that? That's involuntary. Even when you're mentally ill, you still have to sign commitment papers, okay? You can't just check into a mental health hospital. They can't lock you up. I don't understand what the government is coming from. Long story short, Chris, if I can get this message out to the governor, if she's listening, or if anybody from public health is listening, or the PAG is listening, whoever the doctor is advising is listening, I've been getting messages from people who's within the governor's circle that says, Tom, we don't agree with what the governor is saying. We don't agree that we should be locking people up. So
who's saying that, Dr. Shieh? Which of the Adelup insiders is telling you that?
Me to say that? If I tell you that, then I won't get any insider information.
You don't want to blow your source.
Doc, can we just read a portion
right.
of the governor's response letter to your initial letter, so our viewers and listeners kind of have an idea what exactly she said. So her response was, hi, Dr. Shieh, thank you for your email. We tried home self-quarantine for returning residents and it did not work. During the surge of the U.S., many returning came from those hotspot areas, basically all of the United States. We found through contact tracing that there were breaks in the home self-quarantine and was one of the reasons for the surge we are experiencing. We are looking at a 7-day test out protocol. We have not made a decision. Please know that these measures may be hard, but it is necessary to slow the community spread. We are no longer seeing 3-digit increases in cases, but we still remain in mid-double digits, and our fatality rate has increased to 1.51%. I am following this very closely and will make decisions based on data and science. Thanks for your concern. And that was the letter response from the governor to your letter. I believe it was on September 16th. And
and I think I wrote her a 2 or 3 liner response to that as well. And I basically told her, I don't see any data. I don't see any science behind what she's saying. If you look at data and science, look at herself and the lieutenant governor. They didn't travel, but they caught it. They caught it on Guam. Where did they catch it from? Were they following the 3 Ws, the distancing? A lot of the politicians are catching it. So, and when they test positive, they go to their homes. So you're telling me, or you're telling the entire island that, oh, we don't trust you coming back home and you quarantining at home. But yet, we're testing people and they're positive, but we let them go back to their own homes. That doesn't make sense to me. What makes them think that those people who test positive, or those two people who gone out to the 7,000 mass testing, who is quarantined at home, even if they test negative, it doesn't mean that the next day they're not going to be negative. They said it themselves, and that was said in court by Rachel Ajuju. But I think what the government need to do is you really think back. If you want to show me data, then show me solid data. And what science is this? They're locking people up in the hotels. If that's true data, then why haven't the WHO or the CDC has said, hey, let's all arriving passengers, we have to lock them up. That's the recommendation. I don't see that recommendation. There's not data, it's not science. Basically, they don't know what they're doing. It doesn't make sense. It really doesn't make sense. If she's saying data and science shows that, then people need to really be concerned about our leadership. Really be concerned about that, because that's not data, that's not science. And even if the physician panel, if they're saying, hey, that's data, that's science, I have not seen one arrest. Have KUM, have you guys ever reported that public health has arrested 10 people that broke quarantine and published their names, published their pictures, or how much were they fined? If there was that many people breaking quarantine and they know about that, basically they're saying they have data and they know who broke quarantine. If they know those data and those who broke quarantine, publish those data and show me how many people broke quarantine. I'd like to see who they are and where's the pictures. I'm sure they're adults, so they're not minors where you have to hide their identity. Where's the data? Where are those people that they're talking about that broke quarantine? And where are their arrests and where are their fines? Have you seen them?
Is that what you heard, that there were charges filed? I want to say I recall
no,
at
I
least.
haven't heard anything.
Oh,
I have no idea if they charged anybody who broke quarantine.
I think there was one.
Yeah, there is one.
One. There's one.
One.
We have one.
Goodness,
We have one.
And we're gonna lock up 600 in the hotels. Goodness sake, if you can't even follow one person, what are you gonna do? But where are the arrests? If people who broke laws, there's drunk drivers, right? You catch those drunk drivers, but you don't stop everybody from driving just because there are 10 drunk drivers. You're gonna lock down you take away every license. You're gonna shut down the streets because there's drunk drivers.
It's a little different than that, Doc. So what would you say though, Doc? If and this is kind of what I'm thinking the real issue is that we don't have the manpower, the personnel. If we set the quarantine total free, and we get 600 people at home, public health, they can't even keep track of who's in the home quarantine now.
That's no excuse for the government. What you just told me right there, that is not data and that's not science. That is the fault of the government that they cannot contact trace. And that is not a reason to lock up people, the innocent people in hotels. Mm-hmm. I can tell you that right now. What you just told me, Chris, is not science, is not data.
Right.
That's incompetency.
And the other thing is, right now the PAG had recommended to the governor this new protocol, the 7-day test out. If you test negative, you can be released onto home quarantine, but you have to have this Sarah alert. And I got to say, we have been talking about this Sarah alert for a couple of months now. And I don't know why or what is the holdup. If you go and Google Sarah alert, it tells you exactly what it does. And that's what they're hoping to do. At least the PAG is to get public health to implement this. And you cannot be released onto this 7-day home quarantine or early release unless you have this thing on your phone.
I don't think it doesn't make sense. It doesn't make sense about this 7-day. Okay, we're gonna trust you for 7 days, but the next 7 day, you're on your own. So you're gonna trust them for 7 days, and then the other 7 days you get to go. It doesn't make sense what they're just telling again. People on arrival, if they're residents, okay, if they have homes on Guam, they should be allowed to go to their homes. We have to trust them to do that. Okay, but the other mandate I think we should do: mask, wash your hands, and social distance. I think we're doing that. So I think we have to do that. We're not going to get 100% compliance. No way. You're not going to do that. And I don't know what salary alert is. I didn't give the time or the day to actually look at that. But you know, if it's a good app, then use it. But I don't think you should be tracing people. I mean, you know, this book. What is this book? 1984. I ordered this book on Amazon. I'm reading it the first couple of chapters. And you know, it's so true. I mean, 1984 is 2020, and you can replace the leadership here with Guam on Guam. You know, it's so true. 1984.
I feel like we've been living in 1984 for a few years.
There's no data. There's no science of what they're doing. And I'm so confused. You know, I'm trying to
Shieh broke out
understand.
George Orwell on our show.
But
Dr. Shieh broke out George Orwell on our show.
It's kind of, it's really frustrating that, you know, our government is doing what they're doing right now. It really doesn't make sense. A 7-day test out. If somebody has a pre-test already coming in, and that's going above and beyond. That's going above and beyond what the CDC actually recommend. If you're going to test, then require people to pre-test before you come on, because that way you screen out the positives, right? If you're positive, you test positive, don't come on. But then again, you're going to have positive where people recovered. Because if you look at lieutenant governor and the governor, they won't test them again within 3 months, you know, according to CDC, because they could possibly test positive again. So you're gonna be testing people who's positive, but they have no symptoms for 4 weeks, but they could have had the virus 2 months ago and they recovered. So you don't want to lock those people up as well. So public health got to do a better job in dissecting. But Chris, what you just told me is not data and science. What you just told me, if that is the excuse that they're telling you that they can't trace, they can't contact, this is the reason why we got to lock people up.
I'm not saying that's an excuse they told me. I'm just saying that that's, you know, the facts is that they don't have enough people. Whether, I mean, that doesn't make anything wrong or right. I'm just saying that they don't.
Data and that's not
yeah,
science,
of course.
right?
So, Doc, what do you think? What do you think we should do? Just if anybody that comes into Guam with or without a test, just go home if you're a returning Guam resident?
I think what you want to do with this, okay, if you want to go above and beyond what the CDC recommends, sure, you can ask them, hey, come on in if you have a pre-test, you know, go on home and just stay if you have pre-test is negative, okay? Wear your mask, watch your distance, you know, wear your gloves. Let everybody go to their homes if they have a home in Guam. Now, if you don't have a pre-test, go on home anyway, but stay home and wear your mask for 14 days, quarantine at your own home. That's going above and beyond what CDC is saying. CDC doesn't say you have to quarantine. Now, if you don't have a home on Guam, certainly you're gonna have to stay in a hotel somewhere, okay? So you're gonna have to stay in a hotel somewhere, or if you have family, visiting family coming home, somebody has a death in the family, you have a home here, then you quarantine on Guam, it's okay, but you have to wear your mask, watch your distance. That's how you're gonna defend yourself. But if you indeed turn positive, everybody's gotta quarantine at home, the whole family. That's how it goes.
What about testing?
Okay? But don't lock people up.
Shieh, what's your thought on testing incoming at the airport? Like CNMI does.
Okay. Testing incoming at the airport is okay, but what you really want to prevent is arrival of positives, right? So if they're already positive, then coming to the airport, then what's the use? I mean, you're going to screen them at the airport, that's okay. But if you have a pre-test, you don't need to screen at the airport. I mean, if you want to go above and beyond what CDC is doing, if you want to test them at the airport. But Chris, you better make sure that your test is accurate. Okay? You better be darn sure that your test of public health is accurate, because if you test somebody and that's positive, and that person has no symptom for over a month, and it could be a recovery infection, and you're going to lock them up, that's not fair for that person. So if you're going to use a test, the liability falls on public health to ensure that testing is absolutely accurate.
All right.
Yeah, well, people shouldn't be traveling anyway if they're positive. But then you have the asymptomatics.
They shouldn't travel anyway if they're positive. But you know, here's the thing: is that public health testified in court, with Attorney Rachel there, and public health said any test that you have is a point in time. It doesn't matter if you pre-test. See, that doesn't quite make sense to me, Sabrina, because what they're doing now in public is that they're testing people, and after they're tested and negative, okay, you can go. If you're positive, okay, you got to stay home. Stay home, not to the hotel, but stay home. So, we're going in circles here. It just doesn't make sense what you're saying. The message coming out of public health and Adelup has got to be consistent. And what they're doing is inconsistent.
Yeah, good luck. Good luck with that.
A little late in the game.
Yeah,
Well,
Yeah.
it's late in the game, but
Better late
you know,
than
a
never. I
good
got you.
leader has to admit their mistakes. You know, there's several states where the governor has actually apologized to the people of Guam, not people of Guam. Sorry, they actually apologized to their own people. But you know, I think our leaders, if they make an error, don't don't be afraid to come out and say, you know what we did doesn't work. It didn't work, and it's not working. We've been locked down for 5 weeks. It's still not working. You know, I mean, we're still getting double-digit positives, and there is community spread. We're not going to get the same lockdown as China, Chris. We're not. China is a communist country. They can't do those lockdowns. We're in the United States of America. We fought for our freedom. You know, I hate to say that, but that is the truth. We're not going to get 100% compliance no matter what you do in any lockdowns. So I think what we need to do is really focus on mask. And I wear my N95 all the time. Say stuck to my bottle of hand sanitizer. You got to do that. And that's the best way to protect yourself. I walk GMH every day and I test myself every month. You know, I don't have to do that, but I just, you know, I don't know why I do that. That's not based on science either. You know, I do that just because for my own sake, because my wife demands me to do that, and I, you know, can't get near my family unless she makes me do that. Because I walk the hospital, I'm a high risk. But you know, luckily I've been tested negative, and like my daughter said, Dad, if you test positive, then you didn't follow the 3 W's that you keep telling people to do. Okay, if anybody's going to test positive, it's going to be me who walked the hospital, and it's going to be all the doctors and all the nurses, right? So all those people should be testing themselves, because those are the high-risk areas. But be as it may, I think Governor Guam, you know, the governor of Guam should really let the people go home. I don't think we should be spending money going to court. You know, Chris, if I can end this, I think we're fighting the wrong enemy here. Our true enemy is the virus. But what Governor Guam is doing is we're fighting against our own people. And I don't like that. I don't like to fight against our own people. We got to fight against the virus. And people are not viruses. I think we need to treat people like human beings.
There you go, Dr. Tom Shieh, rabble rouser, email writer. Keep them coming, Doc. Send us a
Dear
draft.
Governor, author.
I'm waiting for the book to come out.
Governor, you notice those letters always get out at 5:30 or 6 in the morning.
Yeah, that's when you
know,
have your...
I hit the send button, and sometimes I go, should I send or shouldn't I send? And after I send it, I go, oh man, I can't recall it anymore.
Here we go again.
So much typo, grammar. It doesn't make sense.
All right,
Hey,
Doc.
well, we need people like you, Doc, to voice your concerns. So thanks.
All right, but let the people out. I think there's 600 people locked up. You know, there's mothers in there separated from their babies, and I think they need to go back to their home and be with their kids. They're not infected.
Yeah,
most of them are not infected.
We're about to talk with a woman, Dr. Shieh, who lost both of her parents to COVID, and I think one of the key takeaways when I interviewed her Saturday was that she came back because her parents' condition was worsening. However, she was thrown in the quarantine, was denied a compassionate release, and had to sit there in quarantine while her father died. So yeah, we're on this quarantine, and we're going to be sharing Raquel's story next, Doc. So if you got time, just listen in and watch on the link, okay?
All right.
Thank you, appreciate it.
Thanks, Doc.
I'll mute myself and I'll stay on and I'll watch it with you, okay?
Right on, appreciate
it.
I think she should have been released, and they should have gave her compassionate leave. I think it was inhumane for the government to do that, and I think that I bet you she's not the only person that have done that too, and that's inhumane. Right. And I don't think that they should have done that to her, and I think that's bad, and I think the governor should apologize not just to her but to the entire island of Guam.
Thank you, Dr. Shieh. We'll take a short break, and we're coming back with more of the link on the Breeze 93.9. Yes, we will go in our K-Wave News Zoom room with Raquel Dizon Ike, whose parents were COVID-related fatalities, was able